Audrey. I'm one of the nurses working with Dr. Bardwell today. Hello. Are you Mrs. Briggs?
I am. Crystal
Nice
Briggs.
to meet you. So I hear that you're here today because you were recently seen in the emergency room, possibly due to COPD, or you were having a problem?
I'm not 100% sure what was happening. I've had a little cough for about 1.5 years, I would say, and I feel like it just hasn't gone away. But nothing really else going on with the cough until about a week ago. I was finishing my shift. I'm a bartender, and I just felt like I was kind of winded all night. And then towards the end, I just really couldn't catch my breath. I felt like my production of phlegm was worse. It's usually just clear, if anything, sometimes dry, sometimes productive. But that morning and that day, it was thicker, a little greener, and it was really just the shortness of breath that I was feeling that it really alarmed me. And I didn't want to just go home and sleep and then it get worse. So I went to the emergency room, and they gave me some antibiotics and a breathing treatment, and then sent me home on a Z-Pack. And I felt like that was good. I took it as I was supposed to. The cough production seemed better. And the shortness of breath was a little bit better as well, but I feel like I'm still having just this frequent cough. It's worse in the morning. And then sometimes late at night when I've just been working all night, it'll get worse.
Okay.
I feel it right now, actually.
Yeah.
I feel it coming. Excuse me.
Okay. Let's make sure I'm with the right patient. Can I just get your name and date of birth just to confirm?
Sure. Crystal Briggs, 5466.
Perfect. Okay.
And I'm Taurus.
Oh, Crystal, I'm gonna like that already.
I always say that.
Yeah.
So I'm sorry, I'm stubborn.
Okay. So when you were in the emergency room, it looks like they also did a chest x-ray while you were there just to make sure that things looked okay according to what they sent over for us.
Right.
So in working with Dr. Bardwell, we're just going to do a really thorough physical examination and then just ask lots of questions because what we're thinking is that you are probably going to be newly diagnosed with what we consider chronic obstructive lung disease, which is COPD, pulmonary disease. And you're a smoker.
I am.
Is that correct? Okay.
I
How long
am.
have you been smoking?
Oh, I don't know. I was young. I think I was probably 21 when I started smoking.
Okay.
Yeah, pretty much a pack per day since then. So.
Okay. So that is one of the number one leading causes of developing COPD.
Right.
And since you are in the very early stages of that, while COPD is not something that is curable, we can't give you a pill for it. It's nothing that's going to take it away. But we can do preventative measures and treatment measures that will prevent exacerbations and prevent any loss of your airway, basically. We want to prevent the disease from progressing. Okay, so that's really what we're going to focus on. So before I came in here, I know the medical assistant came in and did a spirometry testing with you.
Mm-hmm.
And that's actually the gold standard to actually give a COPD diagnosis.
Okay.
Normal patients that are compared to your height, your weight, and being female, we do a comparison to get an overall percentage of when you did that. You remember kind of like breathing in and then forcefully breathing out as fast as you can. A normal percentage is about 80%. For anybody who doesn't have any kind of lung, airway restrictive disease or obstructive disease. And for you, it was around 74%.
Okay.
So while it is less than normal, it's not in what we would consider like the severe stages or moderate severe stages. And we want to prevent you from getting there.
Okay.
So right now we're going to say probably mild to moderate, more on the mild side. So that's a good thing. So you've got room to progress in a positive side than in the negative, okay? But it's going to take some work on your behalf.
For sure.
Okay? Sometimes...
Gosh, that's bad news a little bit.
A little bit.
Give me a second
but good. But good.
I don't want to wear oxygen.
You don't want to wear oxygen, so that we want to keep you there.
Okay.
But like I said, there's plenty of things that you can do to prevent the disease from progressing.
Okay.
And we'll talk about that, okay?
Okay.
So as far as your clarity of thinking and your mentation, sometimes patients with COPD will have like a a buildup of carbon dioxide, and carbon dioxide can sometimes make you a little fuzzy on memory and things like that, just because of the gas exchange that you're breathing is a little bit impaired.
Okay.
With COPD, your airways basically become obstructed because of inflammation.
Okay.
And anything that causes the inflammation to get worse, like cigarettes, whether it's firsthand or secondhand, sometimes just environmental toxins, pollution, things like that. If you were working with toxins that irritate the lungs, anything like that will cause that to inflame or exacerbate.
Okay.
And so basically that's kind of what you were having when you went to the emergency room.
Okay.
Is what we would consider you somehow contracted something that gave you like an upper respiratory infection, and that combined with COPD, you got an exacerbation.
Okay.
And luckily for you, it didn't require you to be admitted. It
Right.
didn't require you to have oxygen. So we're catching this at a very early stage.
Okay.
So have you had any like problems with memory, clarity, anything like that?
I don't think anything normal or out of the normal, you know. I feel like I forget things here and there, but I don't think I've noticed anything recently or anything, you know, out of the norm. So
Okay.
at least I don't remember.
You don't remember. That you remember, and that's okay. Nobody's been telling
No
you.
one,
Like,
right.
we've told you
Right.
a million times.
Right.
You
Yeah.
don't feel like
Yeah.
you're
My kids and husband
cloudy.
haven't said, right. I haven't. No one's told me anyways. So
okay.
hopefully.
So that's perfect. And then as far as work related, so you said you're a bartender, which you can be on your feet all night,
Right.
correct? Or I don't know what hours
Right.
you work, but
Right.
that movement of coming up and down, that said it's gotten increasingly worse over the last,
Right.
progressively worse over the last year and a half,
I'd
or
say
just
over the last year and a half, but you saying with the environmental toxins kind of makes sense because that night we were really busy, and I remember I took a few more smoke breaks than normal just because it was such a busy night, and I feel like the kitchen was just more steamy because they were cooking so much. So I feel like the ventilation that night, like I remember walking through the kitchen a couple times to go outside to smoke and it was hard to breathe, and then when I went outside I could kind of catch my breath, but yeah, I wonder if it's work, you know, unfortunately, because even if I don't go on a smoke break, you can smell it from the cooks, you can smell it from the other servers. In my industry, you know, it's just kind of everyone's out there smoking, so I wonder if it's probably has a lot to do with that.
right.
And I work in an older restaurant that has poor ventilation, and I don't know the last time our exhaust hoods were cleaned, and, you know, so it could be. Maybe I need to switch to day shift.
Yeah, switch to day shift, stop smoking,
so.
maybe don't work there, combination of things.
Yeah.
So what we'll do is we'll go ahead and do a physical assessment and just see what we kind of hear, things like that, and then we'll come back and talk a little bit more about preventative measures and how you're kind of digesting things, okay?
Okay.
All right, so we're going to go ahead and sit up here on the table.
Should I take my shoes off? Do I need to take them off? No? Sure.
And then you can actually just stay like this
Okay.
for minutes. All right.
I haven't been to the doctor in a while.
So long, right?
I feel nervous.
That's okay.
I feel a little clammy. I don't think I've been to the hospital since I had my kids.
That's all right. All right, so I'm going to start at your head and just kind of work our way down, okay? Have you noticed any like lumps or bumps in your head that shouldn't be there? No? Okay. Go ahead and kind of look up for me. So I'm just going to feel right here behind your ears and down your throat. And this is just feeling for any like lymph nodes that may be swollen. So sometimes those are the first things that we can feel during infection is that those become enlarged, and those are like an indicator that an infection is developing or inflammation, okay? So no pain when I did that, and I don't feel anything, so that's good. Go ahead and sit like shoulders back, look good. Go ahead and swallow a few times. And I'm just going to feel your trachea area. Sometimes, and this is probably not going to be with you because you're in the very early stages of this, but body habitus can change.
Okay.
So sometimes deviation of your trachea, sometimes even your sternum and things like that can be a little bit more rounded, which we call like barrel chest,
Okay.
just because the lungs tend to be hyperinflated
Oh.
when you have COPD,
Okay.
and that can actually change the structure of how you look.
Oh.
You actually look completely normal. I don't see any sort of higher sitting of the clavicles. The
Okay.
clavicles can sit higher at some point in time, but yours actually look very normal, so that's good. I'm gonna go ahead and look at your eyes. Perfect, equal rounds. I've got my little light here, so I'm gonna blind you, sorry. Perfect. Do you wear glasses?
I do.
You do.
I have contacts in there.
Contacts, no, they look fine. But that's
I'm also
good.
very blind.
I'm gonna take a look inside your ears. Have you had any pain, any drainage out of those, anything like that?
No. It's funny you say that. One of my really good friends always has ear issues.
Tell her.
I should tell her to come
just,
see you.
You know, nothing smaller than your elbow in your ear, and they
I
won't
try
hurt.
to tell her that.
She doesn't listen.
She
Huh?
doesn't listen.
All right, and then just checking some of the nerves. Go ahead and stick your tongue out at me. Say ah. Perfect smile. Good. Go ahead and look at my finger here, and then you're just gonna track it. Perfect. That's always a fun one. You get cross-eyed. Can you see over here?
Yes.
This might be harder for you because of your vision impairment.
My astigmatism.
That's okay. And can you see over here?
Yes.
How many fingers?
2.
Perfect. Okay. Let me take a listen to you. You can just breathe normal right now. I'm just going to listen to your heart, make sure that sounds normal. Okay, perfect. And then
I remember my mom telling me that I had a murmur when I was little.
I didn't hear one.
Oh, okay.
So that's good. So either it resolved on its own, and a lot of kids, a murmur will
Yeah,
resolve
you grow
after
out
they
of it
Yep.
or something. I remember,
Yeah, no, you sound okay.
It's probably fast.
That's okay. Okay, a couple deep breaths for me. And one more. Perfect. So, kind of sound like a typical smoker. So you've got some what we consider rhonchi. Rhonchi is just phlegm.
Okay.
Build up. Sometimes you're going to hear it, sometimes you're not, depending on when you cough and when you cough it out.
Okay.
The good thing is that I didn't particularly hear any crackles or fluid on board.
Okay.
What we really want to prevent is you developing any type of heart issues.
Okay.
Okay, so the longer you have COPD, the longer other organs can be affected by it.
Okay.
And the potential to develop pulmonary hypertension and right-sided heart failure, our percentage of that is growing as the longer you have the disease and the disease progression. And sometimes what we would look for in those indicators is, one, we would hear probably like crackly sounds in your lungs. That would tell us that you've got some fluid on board. And then sometimes edema or swelling, basically in the lower extremities particularly, we would see that, and I'll check those when we get down there. But those are the things that you can kind of monitor at home, is if you feel like, wow, my legs have been swollen, they weren't normally swollen before. Those could be key indicators that it is now affecting your heart. When I was looking at your vital signs, your blood pressure looked great, so we're not having any signs of any kind of hypertension issues in that aspect. I know you felt like your heart rate was going to be a little bit fast, but it was normal when you first came in. It was about 82. And normal for that is between 60 and 100. So you're actually okay there. And I didn't hear any wheezing today. So that's good. I mean, you are recently out of the hospital. You already finished the Z-Pack. So maybe that's, taking effect a little bit so you don't have any wheezing. But definitely I do hear the phlegm and the rhonchi in there. So we want to make sure that we get that out, and you cough it out, and you don't swallow it. I know it sounds gross, but lots of people swallow it. And like I said, your heart sounded normal, right in rhythm.
Okay.
I was able to hear it pretty clearly there. Sometimes on examination of patients that have COPD, the apex of the heart and things are a little bit shifted because of the hyperinflation of the lungs.
Okay.
So these are all things that can be affected, that one leads to the next, and why we really, really, really want to focus on prevention of disease progression with you, okay?
Makes sense.
I'm gonna go ahead and have you squeeze my hands tight. Good, I'm gonna pull, you don't let me, and I'm gonna push, you don't let me.
Okay.
Perfect, equal strength. You've never had any strokes or any impairments, nothing like that. Good, strong pulses. We're gonna take a look at your hands. We're gonna look at capillary refill. Sometimes with patients who develop airway diseases will have clubbing of the fingernails, and you're perfect, so there's no issues there. That's another indicator that you could look for at home by yourself, is the coloration of your actual fingers. To see how they're nice and pink, that's what we want. Some patients who have severe COPD, or as it progresses through less oxygen intake, you'll start to actually see like a bluish tint or tone to your fingernails, and that just means that you're just having less oxygen flow through your body. So those extremities are lacking perfusion, basically. So that's something that you can look for on your own as well. And that could be a key indicator that you want to be seen sooner than later. And then as far as belly pain, you want to go ahead and lay down for me. We're just going to listen to there. Gonna push on your belly. No pain if I push? No. Perfect. So when I'm doing this, I'm just looking for any pain that might be there. None.
Feels kind of good.
No organs that feel enlarged to me.
Okay. There shouldn't be any children in there.
I hope not. We're going to take a quick listen. Now, either you're hungry or you just ate, one of the two.
It's always both.
You've got good vowel sounds. Good. Perfect. Okay, you can go ahead and sit up. Right there. Now, as far as eating wise, do you feel like your nutrition is good? Have you had any like nausea, vomiting, loss of appetite?
Only that day I didn't eat very good, but I kind of contributed it to just being busy. But I felt nauseous for a couple days, but I kind of thought it was antibiotics as well. And since then, I feel like I'm eating.
You haven't had any issues?
Yeah, okay. I haven't had any issues.
All right, so that's another thing, right, is making sure that we keep our weight control, that we're eating things that are good for us, that are not going to, as the disease progresses, some of these patients can go through loss of appetite, they lose weight. Sometimes it's unclear whether it is to the transformation of the musculoskeletal system, and that's why they look a little bit different, proportioned and things like that. But definitely nutrition is a key thing that you want to prevent. Any becoming overweight, because that also affects their ability to breathe. So we want to make sure that that's under control as well. Okay. How about bowel movements? Any problem there?
No.
Frequency, color,
normal.
No blood,
No.
no diarrhea, anything like
No.
that. No signs of irritable bowel syndrome.
No.
You're good there. Okay. And how about urination?
It's good. I don't think there's anything abnormal.
Okay. And it looks good too. I got your blood work results that they ran at the hospital. They kind of do that with everybody. They just take a pre-screen of you to make sure everything looks okay. What we want to make sure is that patients who have COPD, so they have basically like narrowing of vessels through inflammation and things like that. So sometimes that inflammation can move throughout the system. And if your renal arteries, your kidney vessels also become restricted or impaired, you can sometimes develop chronic kidney disease. Yes, so we want to make sure, you see, everything kind of leads to each other. So we really want to make sure that, you're urinating enough throughout the day. You want to kind of pay attention to the clarity, the color, if it's turning, an amber color or a lot of sediment in there, you want to make sure you push your water and fluids, and then that you're making enough. So patients with chronic kidney disease tend to urinate less frequently
Okay.
and smaller amounts.
Okay.
So we want to make sure that that stays under control. So again, that is something that you can look at
Okay.
and say, hey, like I only urinated once today,
Okay.
or it's becoming darker, or things like that, because we do want to prevent your kidneys from being affected by
Right.
this.
For
Okay.
sure. Okay.
So no issues there.
No, I feel like I'm a good water drinker.
Okay.
Grew up in Arizona, so I'm pretty good about it. So
Right.
I feel like that's not an issue.
Okay, that's good. Any menstrual problems?
No.
Perfect. So then we're just gonna look at your legs. I'm gonna look at your feet here. I'm gonna do a little push test, okay?
Okay.
So that's what we're talking about when we're talking about swelling of the legs.
Right.
If I push and it stays, we would call that induration or pitting edema.
Okay.
And that's what you're looking for when we say if you've got swelling in your legs. Is it
Okay.
pitting edema, meaning it stays, and if not, okay?
Okay.
You look fine.
I remember my grandma had that. I remember we could put our whole finger like into her ankle.
Yeah,
So
see? Yeah, just like that.
I can definitely watch for that.
And this side looks good too.
Okay.
All right, so go ahead and push down and push back up. Perfect. All right, so it looks like you've got good strength. Everything looks good there. I think that's about it. Why don't we go ahead and have you come sit down for a moment.
I'm gonna do that too.
Yes, go ahead. Okay, so clearly through examination, your blood values, your spirometry testing, and just your overall presentation that you truly are in the early stages.
Okay.
And we want to keep you there.
Okay.
So how are you up to date on vaccinations?
Yeah, I usually get my flu vaccination.
Every
I
year?
may have missed it last year, but
Okay.
I usually go to the Walgreens, get it for free.
Okay, perfect. If you can get that, that is the number one thing is flu vaccination every year.
Okay.
And the pneumonia vaccine. You probably,
Oh.
because of your age, you probably haven't been given it yet.
Right.
But now you are in what we could call like high risk
Okay.
for developing these things. Before you leave today, we want to make sure that you do get the pneumonia vaccine.
Okay.
And that is just, usually it's once before after the age of 65, but because you're only 54, you probably get it, and you probably get it one more time after this to make sure that you're compliant with it.
Okay.
Kind of help prevent pneumonia, basically.
Like every year?
No, so it's usually after age 65, you just get it once and then you're done.
Okay.
But because of your age, you can get it now.
Oh, I
And
see.
I'd really have to look into the recommendations, but you may get it again like in 10 years
Okay.
as like a follow-up to
Okay.
that.
Okay.
So definitely staying up to date on vaccinations prevents exacerbation.
Right.
And like I said, you'll get the pneumonia vaccine before you leave today. Then
Okay.
medical assistant can come and do that.
Okay.
The biggest thing that's going to help you is smoking cessation. So quitting smoking. How do you feel about that?
I've been trying to quit, I think, for 30 years.
Okay, so 30 years. Jeez. Okay, so how?
It's one of those things I know I need to. And
Yeah. So what have you
I've tried?
tried?
A couple times. To be honest, I think I've just tried cold turkey probably 3 times for 3 days, maybe, and then I couldn't do it. But I've never tried the gum or the fake cigarette or anything
the
like
patch,
that.
anything
So,
like that.
yeah.
Okay, so
I guess I haven't really
cold
tried.
turkey probably
Yes,
doesn't
I've
work
tried.
for many people, right?
Okay.
And even if it does, it's not a long term
Okay.
how it works.
Okay.
The biggest things, you know, in speaking with my colleague, Dr. Bardwell, who runs the pulmonology clinic, is what we really recommend is smoking cessation
Okay.
and follow up with that, whether that is through support groups.
Oh, okay.
Sometimes you can use integrative therapies like acupuncture.
Okay.
Yeah, those kinds of things
Right.
will help you. Meditation, hypnosis,
Mhm. I was
those
just gonna
kinds of
say
things.
that.
If you look outside the box and try those things,
Right.
the pharmacological things like the patch and the gum, those things are helpful. They can use it, but they are more of like a titration system. So you start with a certain dose, and then each week you can break it down, break it down, break it down, break it down until you're done with it.
Oh, okay.
So we can use like a combination of things where you use the pharmacological method combined with an integrative method.
Oh, okay.
And the integrative therapy you can continue for lifetime.
Right.
And that kind of helps. Or finding a smoking cessation group that you can do, whether it's through online participation or just finding what's available in the communities. And while you're getting your vaccine, I can actually probably go on and see what is available in our community that you could do as far as like group sessions. I'm not sure if you want to do the group thing or if you want to try something on your own first. I can put something together that has some of the integrative things, group things, and then do you think that either the patch or the gum, which one do you think would work that you might be willing to try?
I feel like I'm kind of a gum chewer, so I think that would be probably better. I feel like a patch I might forget or lose, or seems like it would be hard. Yeah, I feel like when I think about that, I think it might be. And I did have a girlfriend that used the gum and it worked for her, so.
Okay, so that's good.
I could try that.
Okay, so we can do the gum.
Okay.
We'll do your pneumonia vaccine.
Okay.
I'll give you the list of resources that we have in our community that can help with that. I just kind of wanted to assess like what your willingness was or desire.
I think I'm pretty open to things. I've actually tried acupuncture for pain with my shoulder before and things like that. So
okay, perfect.
I'd love whatever you can give me. I'll take it.
Okay, good.
Sometimes I need to do everything.
Yes.
Just
the other things that we want to talk about are kind of like you said. At the beginning of our discussion that it was kind of overwhelming and kind of like bad news that you got. You know, prior to today, how has your mood been? Are you having any?
No, I feel like my mood's been fine. I don't think I've had any unstable.
Okay. No thoughts of suicide?
Oh, no,
nothing like
no,
that.
no.
Okay, that's good. And then as far as like support system, do you have a good support system that would? Does your husband smoke?
He actually does not.
Okay, so that's good.
Yeah, he actually never smoked. So he's mainly the reason I'm afraid to tell him what I might have COPD because
he was already telling you that you should stop smoking. Okay, so that's good.
Years,
so that's good.
Him and the kids will probably be happy, but no, I have good little social circle.
Okay, good. So you're socializing, you're keeping yourself
he
out
probably
there.
will go with me, honestly, to one of these meetings or something just to support. So
okay,
so yeah,
perfect. And then any religious concerns or holistic things that you have questions, concerns about?
I don't think so.
No, okay.
I'm average.
Average, okay. So what is the biggest thing that you're going to take away from today's appointment here?
Probably that if I don't get my lungs better, my heart and kidneys are next. So it's a big pill to swallow, but I just need to quit, honestly. So I'm glad I'm here.
Good.
I'm glad I talked to you. So.
Yes. Well, I mean, overall, you look generally healthy and things are going well, so I wanted to keep it that way.
Right. Sure.
We'll follow up in about 6 months.
Okay.
For the spirometry testing, we want to make sure that those values are not getting worse, that they're either staying the same or potentially improving. Sometimes the improvement we don't see as much, but definitely we want to not have that number get worse.
Right.
So that is going to be our biggest goal. And
does that number correlate with oxygen? Like if I get to 60, does that mean people
it
are
doesn't
usually on
necessarily
oxygen?
correlate with that because when you came in, your oxygen values were normal.
Okay.
You were still around between 95 and 96, which is great.
Okay.
Patient off of oxygen.
Right.
Patients, when they start to use oxygen, we generally want to keep those patients between 88 and 92.
Oh, okay.
So they're not having as much oxygen given to them just because of that impairment of carbon dioxide and oxygen exchange. Sometimes that more oxygen is worse for patients that require it. because they'll end up retaining more of the CO2 or the carbon dioxide.
Okay.
And that's when patients start getting the clarity starts being affected.
Okay.
So you're actually probably quite far from having to be oxygen dependent.
Okay.
And that's our goal,
Right.
is to keep you
For
off
sure.
of oxygen.
Right.
And so that improves, but that's a great question. But as far as, like I said, your heart rate was normal, your oxygen value was normal, your blood pressure was normal.
Right.
Everything looks generally good.
Okay.
But looks can be deceiving depending
Right.
on what's going on inside. So that's the biggest thing, is trying to quit
Stay on
smoking,
it.
stay up to date on your vaccinations, and get as physically mobile as you can.
Okay.
Eating right, nutrition,
Okay.
those things will all help prevent the progression of this disease. Okay.
Okay.
All right. So we'll make a follow-up with Dr. Bardwell so you can see him.
Okay.
Medical assistant will come in
Okay.
with all of the resources and
Okay.
for your pneumonia vaccine.
Awesome. Okay.
All right. It was really nice to
Yeah,
meet
it's
you
nice
today.
to meet you.
Yes.
Thank you.